Hey, Dr. Shook here. Today I'm going to go over the connection between your gastrointestinal tract and Hashimoto's. If you haven't seen my other videos, I go through other systems of the body like the nervous system, the immune system. I talk about the blood sugar and Hashimoto's connection. These are critical connections between other physiological processes and systems that drive Hashimoto's, and Hashimoto's in turn will create problems with those systems too. So in a lot of times with Hashimoto's, you have to keep in mind that it is a multiple system autoimmune disease. It is not a thyroid disease. The thyroid is being attacked by the immune system, and you have symptoms of thyroid dysfunction and hypothyroidism, which creates a lot of problems. But it is not a thyroid problem. It is an autoimmune problem, and you have other systems of the body that are involved in promoting that disease process. And if you miss that fact, then you are going to have a very difficult time truly improving and optimizing your health and putting it's going to reduce your chances of dampening the autoimmune process, and it's going to reduce your chances of putting it into true remission, which should be your goal. So as long as you understand some of these connections, it will make more sense why you need to support your gut, why you need to control blood sugar, why you have to do other things at the same time that you're trying to support optimal thyroid production and physiological responses of the body to thyroid hormone. So I have other videos. Please watch those. It will help you to really understand this disease process that is much more complex than just a thyroid problem, so that you are empowered to help yourself. So if you have any questions, post them in the comments and I'll help you as much as I can. But let's get right into it. So how Hashimoto's wreaks havoc on your gut and how to improve it. So what I want to talk about is this. I want to go through this diagram. So if you have access to YouTube or to a platform where you can view this presentation on video, do it, because this will help you so much. This is a visual diagram I'm going to go through that shows you this connection between Hashimoto's, your GI tract, and the consequences. So if you have that chance, go to our YouTube channel. It's drbradshook.com. Check it out there and watch this video. If not, just listen and I'll do my best to walk you through this process. So on the screen, I have in the center of a blank slide here, I have a box that says Hashimoto's autoimmune reaction / hypothyroidism, because you have to consider those two things together when you're talking about how this disease process impacts the GI tract. So you have to think about the autoimmune process and the hypothyroidism or low thyroid state that occurs as a result of it. This is critical to understand. Okay, so step one, just understand that is central to understanding the negative impacts on the gut. Now, this process, this autoimmune process in this low thyroid state will tend to do two primary things to the gut. And these have cascading negative effects that you often have to support at the same time to improve the autoimmune process. Okay, so this is going to lead into vicious cycles. So the autoimmune process and hypothyroidism promote these negative changes in the gut. Those negative changes in the gut then result in a negative cascade of consequences that lead to promoting the autoimmune process. And this is a vicious cycle. They feed one another. So you have to intervene many places. Okay, so the first thing that often occurs here with Hashimoto's, this autoimmune process, and the hypothyroidism is that you have decreased intestinal motor complex activity. This means that your nervous system is not activating the intestinal nerves, the intestinal nervous system that feed the gastrointestinal tract. Now, this is a major issue because it does a lot of things. It creates a lot of negative consequences. One of the first things that happens when you get decreased intestinal motor complex activity or decreased stimulation of these nerves is that you get a decrease in intestinal motility. This means that you're going to have slow intestinal movement and constipation. I can tell you that constipation, chronic constipation, is one of the most common signs of a thyroid problem. And a lot of people suffer with constipation and they've never had their thyroid checked, and they should, because it is one of the top symptoms of people that have hypothyroidism, because you don't have normal bowel movement frequency. So this decreased intestinal motor complex activity causes decreased intestinal motility, which results in constipation. Now, it does other things too. The other things that it will do is it will, because the bowels aren't being emptied frequently enough, it causes increases in intestinal bacterial overgrowth and increases in intestinal yeast fermentation. So you can get yeast overgrowth. You can also get bacterial overgrowth, which is a characteristic of the digestive tract of people with Hashimoto's. This leads to a condition called dysbiosis. And this is where you have intestinal bacteria that are overgrown. And in particular, in people with Hashimoto's, they tend to have an overgrowth of bacteria in general, but these bacteria are low in diversity. So there are fewer populations of bacteria, but they're way overgrown. And these bacteria tend to be bacteria that are involved in syndromes, in bacterial overgrowth syndromes like small intestinal bacterial overgrowth. So it's definitely a pathogenic change. We can tell that this is not a correct type of intestinal floral balance. This leads to a lot of different problems. One of the problems that dysbiosis or bacterial overgrowth with low diversity leads to is malabsorption of your micronutrients. So you have this difficulty with the absorption of the vitamins and the minerals that you're consuming. So this is obviously a major problem because all of these vitamins and minerals are required as cofactors for biochemical processes to occur in the body. So if you want normal biochemistry to occur, you've got to have micronutrients present. Okay. So another thing that happens from this dysbiotic gut, right? This overgrowth of bacteria with fewer diversity, with less diversity in the populations of gut bacteria, is that you have a process called intestinal permeability that occurs. Now, intestinal permeability is commonly referred to as leaky gut. Leaky gut is where bacterial, food particles, and chemical particles or chemicals that make their way into the digestive tract can more easily pass from inside the intestine through the intestinal lining into the bloodstream. This triggers significant inflammatory responses that are known to be triggers for and perpetuators of the autoimmune process. This is called intestinal permeability. The lay term for it is leaky gut, but if you look on PubMed and you do a literature search, you're going to need to look for intestinal permeability. And it lets bacterial fragments, partially digested food proteins, and chemicals pass into the bloodstream. And that's a major problem. That's called those bacterial fragments are called endotoxins, and they are known to be significant triggers of the inflammatory response. Now, this leads to autoimmune activation and can promote Hashimoto's. So you see, this is one vicious cycle here. Decreased motor complex activity, lower intestinal motility. So you have constipation, you develop bacterial overgrowth, these yeast overgrowth, you get bacterial imbalances. This promotes malabsorption of your vitamins and minerals. This also leads to increased intestinal permeability and promotes the autoimmune process that can feed into that system again. So a lot of times you have to address this cycle at multiple points. Now, if this weren't enough, Hashimoto's in the autoimmune process and hypothyroidism lead to more problems. So in addition to this decreased intestinal motor complex activity, what we started with, right? One of the primary things that occurs from Hashimoto's, it also leads to decreased intestinal valve control. So through your gastrointestinal tract, you have several valves, which are a muscular sphincter. And these muscular sphincters are controlled by the nervous system. So when you get poor intestinal motor complex activity, where it's not firing these nerves appropriately, you don't get good closure of these muscular sphincters. So one of these sphincters that's very important is in your lower right quadrant of your abdomen. So down where on the right side, lower abdomen, about where your appendix is located, there is a valve called the ileocecal valve, and it's the connection between the beginning of the large intestine and the end of the small intestine. And when this valve does not close well, when it becomes weak and it doesn't have good neurological activation of the muscles, then it doesn't close, and you can get small intestinal bowel overgrowth or small intestinal bacterial overgrowth. And this is where the bacteria from the large intestine move up into the small intestine and overgrow. And it creates all kinds of problems. It's really awful to deal with. It creates bloating and malabsorption and can make it very difficult to eat a lot of different types of plant-based fibers. And it can be extremely difficult to get rid of. A lot of times you can take, there are antibiotics for it. There are herbals, natural herbals for it. There are special diets for it, like a low FODMAP diet. But the reality is, if you don't get that intestinal motor complex activated, it's going to be very difficult to stop the bacteria from regrowing, even if you use antimicrobials, herbals, even if you use true antibiotics, even if you go on a low FODMAP diet. It is very difficult to get rid of it and then keep it from regrowing, because this intestinal motor complex can be poor activation can be a root driver. And that may be driven due to Hashimoto's. That could be also driven due to really problems with the brain, which you see, I talk about that more in the Hashimoto's and neurological web, because the brain with Hashimoto's is often inflamed. You get neuroinflammation. You can develop neurological autoimmunity. And this creates problems with activation of the intestinal motor complex from the brain, from the signal from the brain to the intestinal motor complex. It's not just because of low thyroid hormone or poor thyroid hormone activity or physiology. It's actually neurologically driven problem. And so this can be something that you often can recover, but sometimes you can't recover it, because these systems degrade. I mean, they can degrade, and you can develop problems that you're not able to rehab. So you're not able to revitalize, to get working optimally again. So that can be a real problem. So this small intestinal bacterial overgrowth can be a real issue, because it leads to these malabsorption syndromes too. Now, the other thing, that when you get poor activation of this gut nervous system, this intestinal motor complex, this also causes decreased gallbladder contraction. When you have low or decreased gallbladder contraction, this is going to cause you to have problems absorbing your fat-soluble vitamins. Your fat-soluble vitamins are critical for immune function. Vitamins A, D, E, and K. So if you have low vitamin D and you keep taking vitamin D, but the levels aren't really going up significantly, you're taking, 10,000 units a day or 20,000 units. If it's not going up, then the problem is that you have poor absorption. You're having an absorption issue. And so vitamin A is absolutely critical for the intestinal barrier to recover. Your thyroid hormone receptor, cellular receptor, is vitamin A dependent. So if you don't have absorption of vitamins A, D, E, and K, there are major negative consequences that can come from that. So the gallbladder is a major issue here. So the next thing that we want to consider is when you have decreased gallbladder activation, this is going to create decreased or reduced release of bile salts. Now, when you have a reduced release of bile salts, there are a lot of negative consequences that come from that. Now, relatively recent research, we know that there are these specialized receptors or cellular receptors in the gut, and these are called FXR receptors. And when they are not stimulated, when they don't get stimulated properly, which your bile acids do that, when you produce bile, the bile acids are metabolized by gut bacteria. So you have to have gut bacteria, you have to have the right gut bacteria. It converts these bile acids into what are called secondary bile acids. These secondary bile acids are able to stimulate the FXR receptor. And when this receptor is not stimulated properly, it promotes leaky gut or intestinal permeability, it promotes inflammation, and it can promote bacterial imbalances. And then this leads into altered gut microbiota, or this bacterial imbalance in the gut. And it's bacterial overgrowth with low diversity is very characteristic of the Hashimoto's person's gut. So, and we know that, again, these are associated, this type of microbiome is associated with these bacterial overgrowth syndromes like SIBO. and like SIFO, small intestinal fungal overgrowth. So there are characteristic changes here that feed into these these gut syndromes. Now, when you have this altered gut bacteria, it has other negative consequences. So, a few of the things that occur here are that you have impaired thyroid hormone conversion. So, about 20% of your thyroid hormone actually converts from the inactive form to the active form in the digestive tract. So, when you and you have to have the right bacteria to make these conversions. So you'll have like T4 to T3 conversion in the gut, and these are typically like T4 sulfate and T3 sulfate into their active forms. And so if you don't have the right gut bacteria there, these conversions don't happen. So this could be a reason that someone might have a normal TSH, but still feel bad because they're actually not converting their thyroid hormone into the active form efficiently in the gut. These gut bacteria have very significant impacts on your thyroid hormones that are actually in circulation. So they can inactivate thyroid hormones too, and cause conversion into reverse T3. So they really have a significant impact on the amount of thyroid hormone that's present, and then other types of thyroid hormones like reverse T3, which is basically has a blocking effect on the thyroid hormone receptor. So it's basic reverse T3 is basically we can just say for simplicity's sake that it's inactive. So when it gets into circulation, it can actually bind to the cell where your T3 would normally bind and block it. So this is something really important to understand. Now, these altered gut bacteria also feed into the autoimmune process, and they can, because of the leaky gut that occurs, and also because these bacteria produce byproducts of their metabolism, like short chain fatty acids, like butyrate, acetate, propionate. These short chain fatty acids are known to be very helpful for the intestinal lining or the intestinal barrier, because the cells of the intestinal barrier will use these short chain fatty acids to repair. And if they're not present, if those short chain fatty acids are not present, then these barrier cells do not recover. Okay, so this can lead into more intestinal permeability and promoting the autoimmune process. So you can see there are a lot of interconnected. There's a lot of interconnected physiology here that you have to take into consideration, and that may need to be supported on its own to help break some of these vicious cycles between the autoimmune process and the gut. Now, another thing that happens with these altered gut bacteria is that you'll see this drop in microbiome diversity, right? So we talked about how you tend to see in people with Hashimoto's less diversity. So you have fewer populations of gut bacteria. And that's bad because, again, it creates these issues with the thyroid hormone conversion. It creates a lot of these problems where you don't get these metabolites or these bacterial end products like the short chain fatty acids, some of these vitamins and other things that these bacteria actually make are just not present. So the gut is not as healthy. The intestinal barrier system is not as healthy. You don't get you don't have a healthy mucus layers, and it creates a lot of problems for the intestinal barrier, which is an immune system barrier. It's a critical immune system barrier that when it breaks down, things from the environment get into the bloodstream before they should be there, trigger inflammatory responses, and can promote autoimmunity. Now, this reduced microbiome diversity promotes leaky gut and all of the negative consequences that we see with that. And that leads to another issue. A lot of your immune cells are in the digestive tract, and they're in the bloodstream, in the digestive tract, and they're monitoring this barrier system, this intestinal barrier. And you have intestinal regulatory T cells. These are cells that help to orchestrate the immune response that are all through the digestive tract, because this is a critical interface between the outside world and the inside of your body and your bloodstream, where your immune system is primarily. So there's a lot of surveillance that occurs there. When that immune system, when that intestinal barrier breaks down, it creates a lot of dysfunction with these intestinal regulatory T cells. And this can create a real issue with the balance of the immune system and with the regulation of the immune system. So if you have dysregulation of the immune response, it's going to be a problem for the immune system and for autoimmunity. So these are a lot of the connections between the gut and the autoimmune process that is ongoing, that's promoting thyroid destruction and Hashimoto's. So you have to intervene in as many, if you try to understand if these processes or any of these processes are occurring. A lot of times they are. And when they're present, you have to look at what is potentially driving them and how can you intervene from a dietary, lifestyle, and a nutritional supplementation perspective to support this specific physiology, while you're also thinking about the thyroid, the immune system. And so it becomes very complex. There's a lot of interconnected webs, but what you want to do is put together a plan that is as simple as possible, that hits, what I would call the big dominoes, the big things first, so you can make the greatest impact with the least amount of effort, right? Because it can't be, your approach to these problems can't be so complicated that they cannot be implemented, right? Or it doesn't do any good. So this is important to understand. Now, one last thing that I want to share with you is, the model that I look through when I'm trying to help someone that has autoimmunity is, again, if you can see this on video, this will be extremely helpful, is this model called the environmentally induced model of autoimmunity. And it's called the Triad of Autoimmunity because it has three major areas that converge to promote environmentally induced autoimmune diseases, which I think that all of our autoimmune diseases are environmentally induced. We have genetic susceptibilities, and then there are external factors that set the stage to activate the genes that then result in the expression of an autoimmune disease. And once an autoimmune disease is turned on, we do not know how to turn it off. The best thing that we currently can do is try and remove as many triggers as possible, try to heal the intestinal barrier system, the blood-brain barrier. If there's a lung barrier issue, if there's a skin barrier issue, you want to try to heal the barrier system so you prevent things from the environment getting into the bloodstream before they should be there, which is a major trigger for the autoimmune process. You want to heal those barriers. You want to remove the triggers that we know of. And we know, very, very high level overview, we know that food proteins, pathogens, and chemicals are known environmental triggers. We understand the immune barrier systems better than we ever have. And we know that the third thing that we have to focus on is immune system dysfunction. And that is a little bit more tricky, but we know that things like vitamin and mineral deficiencies are major issues for immune dysfunction. We know that chemical exposures are major issues for immune dysfunctions because they can bind directly to cells, directly to our white blood cells. They can create they can down regulate the immune system. They can upregulate the immune system and make it more aggressive. They can disrupt our hormonal physiology. So we know immune dysfunction, there are a lot of components to that, or pieces to that that part of the puzzle. And even like stress can be an issue that leads to immune dysfunction. Poor sleep can lead to immune dysfunction. There are a lot of things that can factor into that particular component. But what we want to do is try to look at all of these aspects of the person's life and their triggers, their barrier systems, anything that could be contributing to immune dysfunction. Try to identify those factors that are unique to them, and then put together a plan to support their unique triggers and drivers as much as we can, and then see what happens. Give it time, give it 30 days, and then work through their autoimmunity as we put together and modify our plan, and hopefully within a few months, you get really significant improvement. So this is the model that I use. This is the model developed by immunologists, and a lot of immunologists think that this is a fantastic way to look at this. And I agree from a clinical perspective, this is an approach that when I use this and when we followed these, this is a roadmap, you get the best results. Lastly, if you need help, I have a lot of free resources. I'll give anyone as many free resources and information so that you can help yourself as possible. I do work with people via telemedicine across the United States. I've worked with people on every continent. I've worked with, except maybe Antarctica, but I've worked with people across the world and almost, I think, in every state now. So if you need help, I would be happy to consider and take a look at your case. I have a free case review process. So if you go to my website, it's on the screen, but it's drbrad, BRADSHOOK.com. You can click on application for care and learn about working with me. And there's a form that you can fill out that is a case review form, an application for care form. And it just allows you to put all of your information in there so that I can review it and then give you information on whether or not I think I can help with your case. Because there are plenty of times that people reach out to me and I don't think I can help them. And what I do is I don't just say, hey, I can't help you. What I do is I'll look at it and I'll give you feedback, because I'll try to give you my opinion and thoughts and direction so that you're not just wasting your time. You're actually getting my thoughts on the case so that you can use that information to hopefully help yourself. Now, I do have free dietary protocols that I commonly use with people that can't or that don't have access to testing. I have lifestyle strategies that are also incorporated. We use an app, and all you have to do is go to drbradshuk.com/resources, and you can learn more about free access to our app. There's literally no cost. I'm not going to send you emails. I'm not going to do anything like that. I'm terrible at that type of marketing. I just really hate to receive a bunch of spammy emails and stuff anyway. So I don't send emails. If you want to catch up with me and learn more about what I do, obviously you can find me on all the social media platforms because I try to put out information for free that way rather than sending emails. So you can go and access our app, which will give you the dietary strategy I commonly use for Hashimoto's and other autoimmune conditions. Also, the lifestyle strategies are incorporated into the app as well. So you can look, there are different sections where you can read about how to optimize sleep and stress and exercise. And then there's also a supplementation protocol that is a pretty common supplementation protocol that I will recommend to people that don't have access to testing. Now, if I work one-on-one with someone and let's say they can't access testing, I will often customize the protocol, the supplementation recommendations differently than are available in our app. But from a general perspective, a lot of people have used the supplementation protocol that I have preloaded into the app and done very well with it. So that's there for you if you would like that. You can have free access. Of course, there are videos. Post and ask me questions here in the comments, and I'll do the best that I can to point you in the right direction. But I appreciate you spending time with me today, and I hope this has been very helpful. Check out the other videos on the other interconnected webs of Hashimoto's, and just let me know if you have any questions. Thank you. Hope you have a wonderful day. Talk to you again soon.